students to the massive open online course on Indian economy. Today I will discuss health and family welfare. After completing this module, you will be able to understand the relation between health and family welfare. You will get to know the different health and family welfare programs undertaken in India. And finally, you can also identify some gender discrimination or gender issues associated with health and family welfare in India. Now the plan of discussion. First, we will start with the introductory part. In this part, I will discuss the meaning and aim of health and family welfare, the different aspects of family welfare, the interlinkage between health and family welfare, and also different examples of welfare benefits will be given. In the second part, I will discuss about the Ministry of Health and Family Welfare in India. In the third part, I will discuss the health and family welfare programs, that is the different programs undertaken on health and family welfare in the Indian economy. In the fourth topic, I will discuss some gender issues associated with health and family welfare program in India, or some different gender issues which are associated with health and family welfare in the Indian context. And finally, some concluding part will be discussed. So let's start with the introductory part. First, we have to understand what is the meaning of health and family welfare. By health and family welfare benefits, we imply any form of benefit programs which are not limited to medical, hospitalization, surgical, prescription drug, dental, optical, psychiatric, among others. Now, what are the aims and objectives of health and family welfare? Actually, there are twin objectives. The first one is to ensure health care to all. And the second objective is to ensure health care services to all, particularly to the disadvantaged groups like scheduled castes, scheduled tribes, and some backward classes in our society. Now I will discuss the different aspects of family welfare. Basically, we can broadly classify the aspects under three heads. The first one is the family planning for having a small family. The second aspect is the well-being of the entire family, including the child's and pregnant mother's diet and nutrition. The third aspect is to follow up on the children's needs, such as immunization and oral rehydration therapy to assure their survival. Now I will come to the relation between health and welfare. That is, what is the linkage between health and family welfare? Now, we all are aware of the fact that welfare refers to the well-being of the individuals, families, and the community as a whole. The term welfare and well-being are often used interchangeably. And health is fundamental to an individual's well-being. Now we can talk about the examples of welfare benefits. There are different examples like welfare or temporary assistance for needy families. We call it TANF. Food, housing, home energy, child care, and job training, among others. Now come to the second topic of the module, that is the Ministry of Health and Family Welfare. The Ministry of Health and Family Welfare is an Indian government ministry charged with health policy in India. The ministry deals with healthcare, including awareness campaigns, immunization campaigns, preventive medicines, and public health. The ministry is also responsible for all government programs relating to family planning in India. Now I will discuss the different mission of the Ministry of Health and Family Welfare in India. The first and the foremost mission of the ministry is to ensure availability of quality health care on equitable, accessible and affordable basis across regions and communities. The second aspect or the second mission of the ministry is to establish comprehensive primary health care delivery system and well-functioning linkages with secondary and tertiary care health delivery system. The third mission of the ministry is to develop the training capacity for providing human resources with adequate skill mix at all levels. And the fourth one is to regulate health service delivery and promote rational use of pharmaceuticals in the country. Now the ministry is divided into two departments. The first one is the Department of Health and Family Welfare and the second department is the Department of Health Research, DHR. Under the Department of Health, this part of the ministry is concerned with health care, including awareness campaigns, immunization campaigns, preventive medicine and public health. The Department of Family Welfare is liable for different types of aspects relating to family welfare, especially in reproductive health, maternal health, pediatrics, information, education and communications, cooperation with the non-government organizations and international aid groups, and also the rural health services. Whereas the Department of Health Research, DHR, which is created in 2007, concentrates on the researches on estimation of disease burden, health-related affordable innovative technologies, process or product development, translational research and child health care are included in grant-in-aid scheme of Department of Health Research. Now, another important department of the ministry called the Department of Ayush. The Department of Ayush, which basically focuses on research and education, it is basically established in the year 2003. Actually, the Department of Indian System of Medicine and Homeopathy, which was established in 1995, was renamed as the Department of Ayush, that is the Department of Ayurveda, Yoga and Naturopathy, Unani Siddha and Homeopathy in 2003. Now, the different health and family welfare programs which has been undertaken in India will be discussed. The family welfare programs in India include several activities such as Sterilization Programme, Intrauterine Device, IUD, we call it IUD Programme, Contraceptive Programme, Family Planning Insurance Scheme, Janani Surakshya Yojana, Nutrition Programme, Urban Family Welfare Programme and Urban Revamping Scheme, among others. Also, there are several health schemes for women in India, and also along with it, associated welfare schemes for women in India have been undertaken. That is, different schemes were also undertaken for welfare for women in India. Now I will come to the different schemes related to women's health. Actually, there are several schemes which are related to women's health. In this context, mention should be made of the names like Chiranjeevi Yojana, Janani Surakshya Yojana, Kasturba Poshan Sahay Yojana, Rashtriya Kishore Swasthya Karyakaram, Women Helpline Scheme, among others. Also, there are different welfare programs undertaken for the women. To make credit available for lower income women in India, the Rashtriya Mahila Kosh, that is the National Credit Fund for Women, was set up in 1993. Further recent programs started by the Government of India include the Mother and Child Tracking System, the Indira Gandhi Matritva Sahyog Yojana, Conditional Maternity Benefit Plan, the Rajiv Gandhi Scheme for Empowerment of Adolescent Girls. We call it SABLA. Also, there are different plans, that is, the plan in national level has been undertaken for the children. Like the National Action Plan for Children was initiated in 2017, and this scheme was launched by the Ministry of Women and Child Development. Another scheme called Digital Laddu, that is, it gives digital wings to the daughters. This scheme is meant for the daughters specially. It's basically an initiative started with the Association of FICCI and Google Digital Unlock to empower and strengthen the daughters on digital platforms. The scheme Digital Laddu, which was undertaken by the Government of India, is basically meant for the daughters. According to the Government of India, 65% daughters drop out from their higher studies due to household work. So, this program is a nationwide initiative in which every daughter will be taught and trained to develop their talent and skills to work from home itself and get connected with the global platform. In this scheme, daughters can register themselves to avail the benefits from anywhere in the world. Both online and offline facilities are available for this type of program. So this program has taken the daughters in a much improved status. The daughters can now work from both online and offline, and they can participate in the economic activity in a much better way compared to the period in which this scheme was not undertaken. Now I will come to the gender issues, that is some gender discrimination associated with health and family welfare programs in India. We all are quite aware of the fact that the most important component of health and family welfare program is related to health problems of women and children, because mostly the women and children suffers from poor health. The bad health of the women may be mainly due to different reasons, like poor nutrition, gender discrimination, low age at marriage, risk factors during pregnancy, unsafe, unplanned and multiple deliveries, limited access to family planning methods and unsafe abortion services. So women need special care for their health as they suffer from different types of problems due to the several reasons which I have just discussed. Now, if you look at the trend of child sex ratio in all India, then you can see that during the several census years, that is in 1991, in 2001 or in 2011, there is a difference. There is a fluctuation in the child sex ratio in the all Indian context. In 1991, you can see that the child sex ratio is only 945. Whereas in 2001, it reduced to 927. So you can see the absolute difference between the 1991 census and 2001 census, which is equal to 18. Again, if you compare between the census year 2001 and 2011, then you can also identify a difference, absolute difference in the child sex ratio. In 2001, the figure is 927, whereas in 2011, the figure dropped to 918. So there is a difference between 2001 and 2011 census again, that is, there is a decline in child sex ratio which is equal to 9. Again, if you look at the sex ratio at birth as per the National Family Health Survey, that is NFHS 3, which has undertaken in 2005 and 6, and NFHS 4, which covers the years 2015-16, that is in 10 years gap. You can see that the child sex ratio at birth for children born in the last 5 years, that is the females per 1000 males, there is a deviation, there is an increase in the number or in the figure. According to NFHS 3, the sex ratio at birth for children born in the last 5 years, that is females per 1000 males, is 914. Whereas if you look at the NFHS 4 figure, the females per 1000 males is 919. So the figure has slightly increased. That is, if you take the difference between NFHS 3 figure and NFHS 4 figure, the value has raised, the value has increased, and this increase is equal to 5. Now, if we look at the Indian women, then we can easily say that Indian women face a multitude of health problems which ultimately affect the aggregate economy's output. Because if the women face health problems, they cannot work properly, they cannot work at home, or they cannot work outside the home if they are working outside. So in that case, as a result, the outcome is that the aggregate economic output will fall. So addressing the gender, class or ethnic disparities that exist in healthcare and improving the health outcomes is very, very important for the national level as well as for the individual level. It can contribute to economic gain through the creation of quality human capital and increased level of savings and investment. Now, we can discuss the different problems which are associated with India's healthcare system. In India, there are several health-related problems or healthcare problems, such as the health problems of tribal women, the problem due to malnutrition and morbidity, breast cancer, which is very, very common, maternal health, which is also affecting the whole family, HIV or AIDS, which is another important issue in the context of the healthcare system, mental health, suicide commitment, this is also a serious issue, and domestic violence, which should be given prior importance because it affects the whole family, the mental health or the health of the women women existing in the family. Now, regarding the different programs initiated by the Government of India. In this context, several programs are there and some schemes must be mentioned like Janani Surakshya Yojana, Janani Surakshya Yojana, Mother and Child Tracking System, Rashtriya Bal Swasthya Karyakaram, Rashtriya Kishore Swasthya Karyakaram, Preconception and Prenatal Diagnostic Techniques, Family Planning and Development of Nursing Services, among others. Now I am coming to the concluding part of the module, that is the major conclusion or the major takeaways from the model can be discussed. Now we all are aware of the fact that the healthcare is developing increasingly. There are so many issues associated with the healthcare issue, that is the increasing cost of healthcare provision. Healthcare is increasing or developing, but at the cost of increasing cost. We have to pay a large amount for our treatment, for our healthcare. So this is a really problem, especially for the poor and the disadvantaged groups. Also, there is another problem, that is the increasing occurrence of chronic disease. So different chronic diseases are arising very frequently nowadays, that is asthma, lung cancer, so many coughs, fevers. So with the COVID-19, you all are aware of the fact that due to this fever, that is COVID-19, so many people suffered due to this disease. So it has become chronic. For 2 years, this is continuing. Another aspect in the context of healthcare is injuries. This is also a very common phenomena nowadays. So for all these things, that is the increasing cost, increasing occurrence of chronic disease and injuries, the healthcare is developing increasingly. But we should be aware of the fact that the cost is also rising. So some steps must be taken to improve the state of healthcare, which can improve the healthcare system in all India. Different types of steps that may be taken can be classified under different heads. Like healthcare technologies, there should be some more updated technologies to take care of the health for women, children, and for all in the society, especially for the disadvantaged groups like scheduled caste, scheduled tribes, and other backward classes. Another important step may be the improvement in the context of caregivers and care recipients. The caregivers should be more and more aware with the patients or with the care recipients. Another important step that may be taken to improve the state of healthcare may be the residential environments for healthcare. That the environment should be like residence for giving or for providing healthcare to the needs or to the needies. More and more research and development is also needed to improve the state of healthcare. So if we can follow these steps, it may improve the state of healthcare, and that will also help us to build a disease-free nation or a proper healthcare taking economy. Thank you.